In this objective question, from the given option, they are directing us to specify the correct option describing gonadotrophin activity in a normal pregnant female. For this, let me understand the hormone information with this graphical report. After the elevation of the human core gonadotrophin, there is an increase in the level of estrogen and progesterone. With this specification, we are choosing option C as a correct answer. Why? Because a high level of human core gonadotrophin stimulates the synthesis of estrogen and progesterone is mandatory. Why? Because then only the embryogenesis will happen more appropriately. With this specification, we are choosing option C as a correct answer to secure 4 mark. What are the points we told with this graphical report? We are giving as a final conclusion to take the NEET notes. The production of the progesterone and estrogen as a result of human core ionogorotrophin level is a typical gonadotrophic response in a healthy pregnant woman. With this specification, we are ignoring option A, B and D, and we are choosing option C as a correct answer to secure 4 mark.